Vitaly, are there certain types of cancer that are more associated with breakthrough pain?
Sure. Well, first of all, cancer is not stagnant. Sometimes, unfortunately, it relapses, sometimes it progresses. Some cancer conditions are not known in their initial stages to be painful. However, 70% of the patients with advanced cancer have as their primary complaint, they have pain. However, there are certain cancers, such as pancreatic cancer, multiple myeloma, metastatic breast cancer, metastatic prostate cancer, that can present as their first manifestation with acute onset of pain.
Yeah, I agree as well. Charles?
So I was wondering if I could ask the panel a question, even though you're supposed to be asking the questions.
The floor is yours.
What do you think about breakthrough pain in a patient with cancer who is in remission, or has had, in your mind, is breakthrough cancer pain an applicable term to people who may have pain related to the therapy that they got?
Absolutely. So there's a number of reasons. There's neuropathic, post-chemotherapy. There's post-surgical pain. And those are the two biggest ones. Right. But that's for the curative patient, versus the metastatic. So for the curative, yes, I mean, there still is breakthrough cancer pain issues that we have to deal with long-term. Because I have patients on, years on the same regimen, and yeah, I think they do become addicted to it, which is, probably part of it, but they really suffer from the post-chemotherapeutic effects.
Well, I was only bringing up the question to the rest of the panel, and thanks, Jeff, because...
Well, it's a good question, actually.
Because it happens more often than you think.
Right.
And at least in my experience, and then I think it's important to realize that you don't have to have active cancer to have cancer-related breakthrough pain.
It's a great comment, Charles, and clearly this class of agents has been around long enough that we've heard comments from other clinicians like, what difference does it make if the vertebral compression fracture is due to osteoporosis or due to a metastatic lesion? It's just as painful either way. So this whole regulatory sensitivity about what's in the label being approved for cancer pain only, this class of drug.
But and that's where I was going, because in the original studies that led to the approval for cancer-related pain, it was not required of the investigator to prove that there was active cancer, because it's accepted that the chemotherapy, the radiation, the surgery that was done to decompress the spine can lead to cancer-related pain years down the line.
Sure, so it sounds like these patients are not only plagued with their primary malignancy, but also secondary reasons for chronic pain.
I have a young woman, just to make a quick case, is that, she's 40 years old and post-mastectomy pain has been chronic. So and that's, curative patient, young woman, but it requires it.
And that's cancer-related pain.
It's cancer-related pain.
She wouldn't have had the mastectomy without the cancer.
Of course. Yeah, so great comment. So before